How I got into the field of addictions was that after I completed my graduate program in public health with a specialization in health counseling and health education, I spent a lot of work with the Bloomfield and Patterson health departments, working with people that were substance abusing through their other programs. And I became more and more interested. And I had also explored the possibility of working in employee assistance, counseling people at work who were struggling with some kind of substance-related issue. So I went ahead and I did a lot of volunteer work. I started at Turning Point way back in 1979, volunteering to try and get supervised hours to, get my credential. At that time, the credential was a certified alcohol counselor. And then I was offered an opportunity at what was then called Christ Hospital in Jersey City to come in and work with their mental health center, with their CMHC, doing bedside interventions in the hospital and supporting the mental health center staff with any substance-related issues. And that's how I started. And from there, I actually started an outpatient IOP level of care program at Christ Hospital, which I'm so proud that it still exists today. I knew that I was getting close to retiring. I was also looking at the resources and knowing that there were a lot of mergers happening. I had actually been approached several times before reaching out to Oaks. In looking at the process, I realized that for me, I needed to know that COPE was going to be in good hands. And I wanted to make sure that I found a place that I was comfortable with and that I knew met our mission, vision, and values. I also think that what Oaks brought that some of the other places that I looked at, for me, the mission was primary, and the philosophy of care and the organization was primary, the reputation, everything primary in terms of decision making. But I think another piece that came in that sort of enhanced my decision or sort of supported it was the breadth of other services that Oaks offers that COPE didn't and really couldn't because of our size. So to me, I saw lots of potential for not only growth of the organization, but again, for me, coming back to growth for my staff, having opportunities to be able to move up in ways that being just at COPE may not have allowed, and being able to sort of stretch and show what they're capable of. And I'm grateful for the fact that we now have an organization that we can provide COPE at Oaks integrated care up in Northern Jersey. I think that the Northern Jersey part can benefit from all the programming in the Southern part. So I think, again, I'm extending my gratitude, my thanks for keeping my dream alive.